Hello, everyone, and welcome. As you come in, please respond to the poll that you're seeing right as you log in. If you could mute yourself as well as you come in, that would be very helpful. Okay, great. We'll give people just a few minutes to come in before formally launching into today's lecture and discussion. But I wanted to first introduce myself and introduce everyone to this weekly series that we're kicking off here at TDR. So I'm Dr. Anna Kalbarczyk. I'm an independent consultant with WHO-TDR, and I'm supporting this lecture series, which is led and designed by Dr. Manaz, whom I'm sure all of you are very familiar with. Today, we are starting off with our very first in this lecture series, which is designed for anyone who's interested in implementation research, students, faculty, alumni, to come and just listen, reorient themselves to implementation research, and engage in discussion with fellow implementation scientists around the world who are enthusiastic about doing this work. Today's session, our first session on contextual factors, barriers, and facilitators is being led by Dr. Piyusha Majumdar. Piyusha is an associate professor at IHMR University in India. She is an implementation scientist and an anthropologist by training. And at IHMR, she serves as the co-PI on a multi-country study STRIPE, or Synthesis and Translation of Research and Innovations in Polio Eradication. And she's also the project coordinator for implementing the TDR postgraduate scheme in India at IHMR. So I ask you all to welcome Dr. Majumdar to come and give our first lecture. Please feel free to engage in the chat. Make sure that you are introducing yourself and asking questions there, and I'll try to moderate throughout. We've also enabled a caption translation so that if you would prefer to see captions in a language other than English, you can go to captions, select the speaking language as English, because Piyusha and I will be speaking in English, but you can have automatic translations in another language. And I'll put instructions in the chat for that as well, just to see if this makes it easier for us all to converse. All right, Piyusha, welcome, and over to you.
Thank you so much, Anna, for this detailed introduction. And good afternoon, good morning, and good evening to one and all present here in this session. As Anna mentioned, I'm Dr. Piyusha Majumdar, and I'm a faculty at IHMR University, India. And before I start this important session, I'd like to thank TDR for giving me this opportunity to be a part of this lecture series, which is mainly focusing on core competency of implementation research. So the presentation that I'm going to give, it's all about the implementation strategy. And we're going to discuss how the contextual factors act as a barrier or it restricts the evidence-informed intervention in reaching the target population. So these barrier and as well as bottleneck and the facilitators, they also for implementing any evidence-based interventions, they're specific to different contexts. So as an implementation researcher, we must analyze the context at all the stages of implementing any complex public health intervention. Okay, so in this lecture, we will be learning about what are the contextual factors which is relevant for the implementation of any evidence-informed health intervention. We're going to discuss the contextual model and framework which is available in implementation research, And that can be used for analyzing contextual factor that can act as a barrier and facilitator. And also we will be discussing how we can apply framework for analyzing context in the implementation of evidence-informed intervention. Now, coming to the definition of context. By definition, it is a set of characteristics and the circumstances that consist of active and unique features that surround the implementation. For example, if we want to implement a new public health program in any country, when we talk about the context of India, it is completely different from some other country. If we say, if we take Syria or Ukraine, so their political scenario, their culture, socio-economic situation, everything is different in two different countries. And this context, basically, it interact, it influence. It can also modify or facilitate. It can even constrain the intervention and its implementation in a particular geographical area. So basically, it is also considered as a versatile construct because it is not only affecting the physical setting, but also the role and how it is interacted, what is its relationship with various factors, and it also influences the implementation of an intervention. Now, before coming to the contextual determinant or contextual factor, let us discuss what is EII or evidence-informed intervention. So, generally, for any complex intervention, if we deal with any complex intervention, its effectiveness and its success. May I request some people to please mute their mic because I'm getting a lot of echo. Thank you so much. So the effectiveness of any complex intervention and its success in reaching the target population, they're basically influenced by the context in which it is implemented. So that is why we have to deal with, in implementation research, we often deal with the evidence-informed intervention. So evidence-informed intervention, it comprises of various programs. It can comprise of the tools, the policies, or the practices that have already been demonstrated earlier. And as per evidence, or as per research, we know that this intervention works well in a particular setting. So evidence-informed intervention, they are basically complex health intervention, and it also combine different component of strategy that can influence multiple outcome. And it also operate at different socio-ecological level. Can be at the individual level, it can be at the community level, it can be at the organization level, and as well as the health system level. Now, this is an example of a complex health intervention, and we have explained it by using the socio-ecological level. As you can see in this diagram, there are four socio-ecological level that is existing: health system level, organization level, community level, and individual level. Now, we are taking an example of a public health intervention, basically a disease control program. And why, for example, here we have taken the example of visceral leishmaniasis. Now, any particular health program, it is being considered as a complex because we need to take the strategy by looking into different socio-ecological level. And the effectiveness of this program, it depends on the multiple factors that occur at each level. For example, if we look into the health system level, there are various strategies that are used to control the sandflies. But at the same time, when we look into the organization level, we need to look into the advocacy in the human resources. We need to look into the advocacy in logistics, and we should have the vaccine to run the program effectively. When we are looking at the community level, we need to ensure that there should be a community mobilizer, community advocacy, and as well as the education, so that they can inform about the strategy and improve the living condition of the people. When we are looking at the individual level, people should be educated about the diagnosis and the treatment of the leishmaniasis. So if there is a lacuna at any level for this complex health intervention, this program will not succeed in reaching the target population. So that is why it is important that how it is critically influenced by each system, and we need to take into consideration at each context how it is implemented. Now let us understand what is contextual factor or contextual determinant. So in implementation research, there are various framework that is used to analyze different contextual factor. So the key contextual factors that can be analyzed is the CFIR, Consolidated Framework of Implementation Research, and CICI, Context and Implementation of Complex Intervention. And when we talk about the context, so these contextual factor, it also include external setting, it include internal setting, what are the characteristics of the individual, and as well as the characteristic of the individual and the intervention process. So context include everything, whatever is external to the intervention, and it also act as a barrier or facilitator to its implementation. So as I said that there are external setting which act as a contextual determinant, inner setting. So this external setting basically include geographical, epidemiological, socio-cultural, economic, ethical, legal, and political factor. And these factors act as a contextual determinant. Similarly, when we take the inner setting, so there are organization factor like leadership, what is the culture of the organization, what is the implementation climate, what is the implementation readiness. So it also acts as a important contextual determinant that affect the implementation, successful implementation of any program or policy. When we talk about the individual factors, so attitude, autonomy, self-efficacy, socio-economic status, they are also described as a contextual determinant that affect the implementation. Now, I'll be giving some more examples to make it more clear to the audience. Here, I'm giving the example of an external setting that act as a major facilitator and barrier in implementation. So we talked about geographical barriers. So just geographical barrier has a mountainous terrain, if there is a flood. So all these things, it limit the physical access to any evidence-informed intervention. If you take the example, sometimes it is really difficult to deliver the highly efficacious vaccine if there is any geographical inaccessibility, and especially when it comes to the low and income country. Then another contextual determinant is the epidemiological factor, and it refers to the distribution and determinant of the disease, and as well as the determinant in population. Now, there are socio-cultural factors, and the socio-cultural factors refer to the prevailing cultural norm that is existing in the society. And this cultural factor, it can inhibit or it can also facilitate the uptake of evidence-informed intervention in the community. For example, there was a cultural tradition of discarding of first milk or colostrum of mother for the mother who has recently delivered a baby. So that's a cultural tradition in some of the country, but it has negatively impacted because it has negatively impacted the early initiation of breastfeeding. So these are some of the factors that affect the implementation of any program. Then comes your socioeconomic factors that includes poverty, food, economic insecurity of a community. Socioeconomic factors is also act as one of the determinant in the context of implementation research. And we need to do the analysis of inequality, or maybe we need to identify the vulnerable population, their socioeconomic status, what is their income level or education status or occupation of a given population. So these contexts need to be analyzed before actually implementing any intervention. And now there are ethical and legal factors. There are certain laws and policies that can facilitate or hinder the implementation of any evidence-informed intervention. For example, there are educational campaign, behavioral change campaign that can reduce the prevalence of any female genital mutilation. But as per ethics or as per, there are certain legal factor that is associated with the female genital mutilation. Similarly, there are political factors like instability. There are some geopolitical shift, or the ownership and commitment was not there. Then prioritization of a health program may also change as per the political change. So these are some of the contextual factors that affect the implementation of the program. Now here, I'm giving you a very pertinent example of how the external setting, and here the external setting or the contextual factor is the geography. So this is an example of a geographical context in which, and we are taking an example of global polio eradication initiative program in Bihar state, which is in India. And how, they have studied the geographical context and tackled an important issue, and then adapted their strategy and then made this program a successful. So what has happened, in spite of having the intervention in place, the number of polio cases, which was reported in 2007 and 2008, it was increasing. And the major reason was there is a large number of population and they got displaced. So there's a displacement of a population. And this displacement is basically due to some natural disaster. And then there is another challenge, which was the population shifting between dry and wet season. So there was a thing that population, they shift from one place to another when there is a dry and wet season, and especially after the flood. So as a result of this, there are 15 to 20% of the children which got missed taking the polio drop. And as a result of this, the polio cases were increasing. So after studying this geographical context, the researchers found that there was a need to adapt the strategy as per the geographical requirement. And then they have developed a very unique strategy, a very innovative strategy, which is known as Kosi River strategy. And as a result of this strategy, there were various tools that have been introduced, like GIS maps were used, that basically used to locate the site of poliovirus reservoir. And by using this strategy, the number of polio cases, it got reduced from 330 in 2008 to 0 in 2011. So because of this reduction in the unimmunized children in hard to reach area, so we have been able to eliminate the polio from our country. So this is just an example how external setting can, or the geographical context can act as a barrier, and how we can actually study it and analyze it and adapt our strategy as per the context. Now, the second example that I'm going to give here is the inner setting. As I've already explained what inner setting is. So inner setting is like organization factor, individual factors that is affecting the implementation of evidence-informed intervention. There are various organization factor like leadership, culture of the organization, climate, readiness. I guess we've already studied all those things. So I'll be straight away coming to the example that I'm going to give here. So as you can see here, we're discussing the contextual factor, which is related to the implementation climate. And this act as a, a major barrier in access to the intervention. So in 2000, here again, now I'm giving you an example of India. So what has happened in 2000, uh, because India wanted to eliminate polio from the country. So the number of immunization round, it got increased. Initially, it was 2 times a year. Then in order to eliminate, so the number of immunization round, it got increased from 2 to 6 times. So though there was an increase in the polio round, but the coverage was less, and it was found that there has been increase in the cases. So despite of all these things, there was increase in the cases. Then after studying, it was found that the major challenge here was the first of all, the number of cases were concentrated mainly in one of the state, that is Uttar Pradesh, and the major reason being that there is a trust. So the challenge, there was a major challenge which is related to the trust between health service provider to beneficiary. So the beneficiaries thought that there's a trust, it's a trust deficit. So that is why it was found that it is there should be a restoration of faith in the government health system, and there should be a positive health seeking behavior. And one, after analyzing the context, one of the important strategy that has been developed and that have been adapted is the social mobilization strategy. So they thought that there's a seriously a need to adapt this strategy as per the contextual requirement. So this context, the context here was implementation climate. So the social mobilization network emerged as a major strategy to deal with the apprehension of the community. And it also helped in building trust in the community by involving a lot of community mobilizers. Now, third contextual determinant, which is characteristic of the individual. So as I said that there are various individual factor, the one who is actually implementing the program. So individual factors such as attitude, autonomy, self-efficacy, socioeconomic status, commitment of the person, of either the person who's implementing the program or the beneficiary. So it is also one of the contextual determinant that affect the implementation of evidence informed intervention. Attitude, attitude is also one of the factor, the way one think and feel, what is their individual belief. Then individual belief or practice, or what do they feel about a particular intervention. So all these individual factor basically affect the implementation. Then comes your self-efficacy. Self-efficacy is how an individual, they believe in his or her own capacity to execute a particular behavior or to do some performance. So all these things and commitment also, how this person or member of the organization, they accept or believe in the intervention, or they believe in the organizational goal. So all these things, they actually affect the outcome of the implementation of the evidence-informed intervention. Now, this is again the example in which characteristic of the individual. So how characteristic of the individual affect the implementation of an intervention. Again, I'm taking an example of global polio eradication initiative. So what has happened? Despite of the best effort of the government, it was found that there were, a large proportion of the population, large proportion of children, they always missed from getting the vaccine. And as a result of this, it was found that the major reason was, first of all, they have intensified it. So as a result of intensification of the NID, National Immunization Days, especially in the high risk area, it has caused a health system fatigue. So the people who are working in the health system, there was a health system fatigue, and because there is a repeated PPI, so that is why there is a repeated fatigue, and this is mainly the contextual determinant here is self-efficacy. So health workers, due to continuous campaign, they have, they've experienced a fatigue. And the major challenge was to retain the momentum of health. Basically, the health workers were involved in other frequent vaccination, and they were also involved in other programs. So that is why that is the major challenge. And another thing that there was a weak linkage in the intersectoral coordination. And also the planning was not proper at the lower level, at the grassroots level. And there was a poor level of monitoring because of the health campaign fatigue, health system fatigue. So now, in order to keep the efforts or sustain effort from the health workers, so they thought that there was a need to adapt the strategy as per the context. And here the context which we are talking about is self-efficacy. So one of the innovative strategy that they have used here was co-delivery of services. So this co-delivery of services reduced their fatigue among the health workers, and as well as it helped in retaining the momentum for the polio immunization activity. So now I have discussed how these contextual determinant, and I've given you the example in India that how these contextual determinant affect the implementation of a program, and how after analyzing the context, all these, the challenges got tackled by adapting to the strategy. I'm looking at the somebody's hand is raised. So just let me just finish this and then we can have the question. There are only 2-3 slides left. Is it fine?
Yes, ma'am.
Yeah, thank you. So now, as we are also discussing some other model and framework for assessing context. So there are 4 commonly applied framework for analyzing the context. One of them is the TDF, Theoretical Domain Framework. Then we have PARIHS, Parihas, which is Promoting Action on Research Implementation in Health System Framework. Then we have CFIR, Consolidated Framework of Implementation Research, and CICI. When it comes to Parihas and CFIR, they're applicable to both public health and clinical intervention, and CICI is mainly applicable for public health interventions, not the clinical one. Now let us discuss what theoretical domain framework is all about. So TDF, or Theoretical Domain Framework, it uses theoretical approaches to the intervention, but which is aiming at the behavioral changes. So TDF comprises of 14 domain and 84 construct, and these domains focus into the behavior change theories, and we also do the assessment and the explanation of the behavioral problem and the barrier that is associated. And by analyzing this, we can inform the appropriate interventions. Now, the 14 domains which is there in TDF is knowledge, skill, social and professional role, and identity, belief about the capability, optimism, belief about the consequences, reinforcement, intention, memory, attention, goal and decision process, environmental context and resources, social influence, emotions, and behavioral regulation. So each of the domain, they have construct that can be used to find out whether the specific domain is a facilitator or a barrier for an individual so that they can adopt or implement any evidence-informed intervention. Then comes Parihas, promoting action on research implementation and health system framework. Now this framework, Parihas, it identifying the contextual determinant like culture, that includes the values that are concerning with any innovation, power, authority, allocation of human and financial resources, equipment resources. They also consider if reward and recognition can affect the implementation. What is the kind of a leadership here? Role clarity with the people who are implementing the program, teamwork, the organization structure, decision making. And so all these things basically applicable at both individual, organizational, or system level to understand their role, and that these contextual determinants play for successful implementation of an EII. In implementation research, for any implementation research, the important framework that most of the time we use is Consolidated Framework of Implementation Research, and CFIR. And CFIR basically identify 5 domains, and these domains influence the implementation process. So, and they have 33 construct also. So these domains are the characteristic of the program, the individual who are involved in the implementation. Inner context we have already discussed before in the session, organization, culture, leadership. The outer setting, outer context or the setting, what is the client's need, policy, funding, priority, and the implementation process that comprising of planning, reflecting, and evaluating. So this is a CFIR framework that comprises, so you can see the 5 domain and as well as the different construct of CFIR. We have already discussed some of this before. The last one is CICI, which is context and implementation of complex intervention. So talking about CICI, it is basically when we look at CICI, so it is a graphical representation, as you can see here. The CICI, it is a graphical presentation of 3 major dimensions. One of the dimension of this framework is context. Another is implementation. And third one is setting. I hope I am audible.
Yes, ma'am.
Clear.
So as we have already discussed about the context, so context comprising of 7 domains: geographical, epidemiological, socio-cultural, socio-economical, ethical, legal, and political context. We have already discussed this extensively. Then implementation. So when it consists of implementation, so there are implementation theory, implementation process, the strategies that we are looking into, implementation agent, and the implementation outcome. So in this framework, the intervention and its implementation, both the thing, as you can see in this diagram, they both interact with the context. So the intervention, the context, and the way this intervention is implemented, they are, it depend. They are dependent. So depending on the nature of the intervention, the implementation, and the context in which it is occurred. So when we talk about the setting, so you can also see here the setting. So the setting can occur at 3 levels. First one is the meso level. Meso means, when we meso, macro, or micro level. So macro level means when we wanted to, introduce this to the whole health system or country. Meso level, when we wanted to introduce in a particular, hospital or any hospital or any other organizational level. Micro level, when we wanted to promote any behavior at the individual level. So we need to look into all the three aspects when we wanted to understand the context and implementation of any complex intervention. So here, I'll be giving you an example of a TB control program in South Africa. And this will tell you how we have applied this CI/CI framework to identify the contextual barrier, contextual determinant, for this TB control program, control program in South Africa. Now, when you look at this CI/CI framework, when this program was launched, so WHO, they were aiming at reducing TB death and TB incidence by 2035. When we talk about South Africa. So what has happened in 2019 when there was an increase in the cases, there was an increase in the incidence rate. So what has happened, that TB testing rate was increased, but it was found that there were so many cases that have undetected TB burden. And when we studied, it was found that there are various factors that are responsible for it. There is a health system delivery failure. There were clinics were understaffed. There was poor communication of result, medication stock out, inadequate infrastructure and monitoring system. Then there are HIV TV service integration. In 2020, COVID-19 also hit, and as a result of it, there was an increased complexity of diagnosing the disease. So what is found that the major implementation problem was the diagnosis was delayed. So there was a delayed diagnosis of TB cases for the healthcare facility at one of the district, which is KwaZulu-Natal. So when contextual analysis was conducted at each level, epidemiological, institutional, political, cultural, and socioeconomic level. So it was found that the TB patients majorly come from the household where there was a low socioeconomic status, and they have high unemployment rate. And as a result of this, there is a high burden of TB with those population. When they did an institutional context analysis, it was found that there is a inefficient referral pathway, and there is inadequate TB screening. As a result of this, the TB burden also increased. When they did a socio-economic contextual analysis, so it was found that there was a cultural stigmatization, and as a result of this, people, they were not going for the diagnosis of the TB, and that is also hampering their diagnosis and as well as the treatment. When they looked at the context at macro and micro and meso level, it was found that in the macro level, there was several contextual factors like cultural stigmatization, and also the intervention characteristic like vertical disease programming approach that affect the implementation. Then there are other implementation factor at institutional level. There is a fragmented public health provision. There was a limited support which is available. At meso level, there is a community, the inadequate screening, poor sputum collection. Community, they have fear and stigma. And when it comes to the micro level, it was found that the place of intervention, the place where it is, at the hospital level, the sputum collection was also poor. So while understanding all those things, they have adapted their strategy, and then the program got implemented, and it become better. So TB got really controlled after adapting the strategy as per the contextual determinants. Okay, so this is my last slide. I hope I am very much on time. So this is a reflection exercise for the students who are doing implementation research. So while doing your implementation research, while planning for your study, the first question that you'll be working on is which characteristic of your setting it influenced the intervention and its implementation, how it is reaching the population and its effectiveness. And another question is, you need to find out, is there any contextual factor that influence the implementation? Is there any contextual factor that affect the population reach and its effectiveness? And this best framework we have already given that can be used to analyze the context, and you can use any of the framework, whether say CICI or CFIR. And thank you so much. So the take-home message is, when it comes to any complex intervention, so its effectiveness and its success depend on how it is reaching the population. And as I said earlier, it strongly depends on the context in which it is implemented. So we need to study the context earlier. Context can be anything. It can be external to the intervention that can act as a barrier or facilitator. It can be an inner setting that can act as a barrier. We really need to understand the relationship between the intervention and the context. And as I said, that there are various numerous theories and framework and model that can be used. So that's it. And so you need to, and as an implementation researcher, you need to analyze the context before implementation of any public health program. Thank you so much. Thank you for patient listening.
Thank you so much, Piyusha. And maybe you could stop sharing your screen just so that we
Thank
can all be
you.
in discussion. So we have 15 minutes left,
And
and
I'm
we would like
unable to hear the questions.
Okay, let me see. Can everyone else hear me? Maybe just a thumbs up or yes in the chat. I see Manas has joined. Can you hear?
Yes, everybody. Thank you so much. Thank you, Colombia, Ghana, India. I don't see anybody from Indonesia. Probably it's late. And where else? All the colleagues from all over the
Thank
world.
you
My
so much.
apologies.
I don't know. There's some technical glitch and I'm unable to hear the question. May I request you to please write on the chat box?
Yeah, we can try Piyusha. But first, I think there was a question from Warisha Mariam. So we can start there.
Yeah. Thank you, everyone. Thank you, Piyusha ma'am. It was a very simplified presentation. Ma'am, I had a question. Like, I am from India. So, ma'am, I was relating to the example for the individual context that you gave. So, the fatigue of healthcare workers is still there in the national health programs that is being implemented still today. Like, say, for example, the ASHAs and ANMs are being utilized in all the healthcare programs for the delivery of the services at the ground level. So, ma'am, other than this example, what is that individual context example? Any other example? Because I could not exactly understand that individual context. How to, while in my mind the National Health Program of India is there, I could not understand the individual context. Other than that example of HR, that if I want to make an contextual in that regard. Hello.
Yeah, thank you so much. I've tried to type the question for Piyusha. So maybe Piyusha, if you can say more about individual contexts. And maybe I can ask others to type their questions in the chat, though I see, Gloria, you have your hand raised, so I'll call on you next.
Yeah, and Anna, thank you for the question. I can see in this chat box. As I said, that fatigue, yes, yes, definitely. So talking about the individual context, as I said that, the fatigue of the health workers, it is still there in the national health programs in India. And ashas are being overburdened. It's very true. And I think when we should, try to delegate the responsibilities, equally among other health professionals also, in for handling that issue. And in case of individual context, so individual context, there are various factors. There are various behavioral factors that affect. For example, self-efficacy. I said self-efficacy is there. Then there are leadership also, the commitment of an individual, how a person is committed enough, and the leadership, how this leadership is promoting the intervention. So all these factor, they affect the implementation. I hope I have answered the question.
Yes, ma'am. But just, Mr. Ma'am, just one example. So now UVIN is being launched across the country. So what I have that field experience is ANMs are still not digitally very handy to use that application and everything.
I'm
So
sorry, I'm not being able to hear. I don't know, some issue is there, and I'm trying to resolve it. I'm not being able to hear the question. So I am requesting you to please write on the chat box so that I can read it. And
okay, ma'am. Thank you.
Thanks, Piyusha. Yeah, please,
Can I
and
ask,
any more
please,
time.
Anna, can I ask the
Yeah.
colleagues, can you make your question very short and to the point? And also, let's move around the continent so that we give opportunities to everybody. Yeah, thank you.
Thank you, Manaz. Okay, Gloria, and then Elena next.
Well, thank you for this opportunity to share between all of us the knowledge about implementation science. I want to point out about the CICI framework, in which I see that it's different, very different to the CEFIR, to try to understand the various facilitators,
yes,
specifically. Oh, I thought you were no. Yeah, so let me
yes.
go.
Okay.
Let me do the question.
Gloria,
Yeah, let me do the question. So,
you're
so
asking about the CICI framework.
exactly.
So yes,
So
CICI
let me ask the
framework,
question.
I mean, it is not very different from CFIR framework. It's just that we need to understand that how the implementation and the context and implementation interact with each other. And at the same time, we also need to see the setting here. The setting we are, in CFIR framework, we are only concerned with inner and outer setting. And here we also need to understand the setting at how it is operating at the national level, how it is operating. So at each setting, we need to find out the contextual determinant, how at each setting contextual determinant is affecting the intervention, which is not there in case of CFIR framework.
Exactly, that's the point, that there are many points that are missing in the CICI, specifically, for example, with the intervention characteristics, which they need to be changed in case that you have really constraint. And the questions are more tailored to really find the specific implementation strategies, especially if you use the ERIC CEFIR matching tool. So I want to point out that because we should not lose that importance of integrity on the whole program, the complete picture. And I think the CIC is very particular to some points. It's good. I mean, it will add some knowledge, But I want to point out that the CEFIR is more complex, but it's more integrated and it's more broad and will give you a more really answer when you look for context.
Great. Thank you so much, Gloria. Elena, over to you.
Yes, hello. Just wanted to ask about, well, basically I had a previous question regarding how vertical implementation of the TB control program in South Africa affected the implementation positively or negatively. And before I get an answer for that, I want to explain where I'm coming from in that question, which is basically that in some research that we've been doing here in Colombia regarding the implementation of molecular tools for TB diagnosis, we found that the high turnaround of personal contracts and the sort of fragmentation of the health system in providing the TB control program is a barrier to appropriate implementation of using the molecular tools. But that is also related to an outer context factor, which is related to the way the health system works, which is a managed care health system. So that relates to the previous intervention. That is the importance of knowing the relation between inner context and outer context factors and how they relate to one another and how they determine one another. That's all I wanted to comment.
Great. Is there a question, Elena?
Well, if there is time, I would like to hear about how vertical implementation of TB control program affects South Africa TB control program.
Okay, thank you. I'd like to offer another question that's in the chat that I think a really interesting one to pursue and very related specifically to the topic of context. And Piyusha, I'm assuming the captions are working for you. Can you just nod yes yeah, great. So there's a question in the chat from Akram. What are common challenges or limitations in developing and applying a contextual framework in implementation research? Because I think we talk a lot about the importance of applying a framework to all of the research that we do. So what are some challenges or limitations to applying such a framework?
Okay, am I audible?
Yeah, we can hear you.
So as you said that, what are the common challenges in applying to a framework? So these I guess the challenge to applying the framework is after we need to decipher the information from the people in order to find out the context. In order to find out the context, some of the challenges are people are not aware about this framework. One of the reason is people are not aware about the framework, and second reason is they are not aware how to decipher information about this framework. How can we get the information about the challenges regarding to the context? What tool can be used? How a tool can be developed? Or the questionnaire can be developed that can decipher the information from the from the people who are implementing the program. So these are some of the challenges.
Okay, great, Piyusha. I heard you say a lot of people aren't aware of them. They don't know how to use them, or they just don't use them. Okay, we have a few more minutes. Are there any other questions specifically?
Yes.
Yeah, Manaz.
I would like to respond to the statement made by Elena about how the vertical TB implementation, TB program was implemented in South Africa and whether it was successful or not. I guess because I actually have worked on some TB-related program, TB HIV in South Africa in 2008 till 2012. I might just make a comment on that. Are there any colleagues from WITS here right now? Well, no. Okay, so again here, I think, Elena, the inner and outer context, perhaps mapping is very important because TB is driven by HIV in South Africa. And to have a vertical TB program without keeping into consideration the HIV epidemiology or burden of HIV in South Africa, perhaps, you know, we know that we during the 3x5 initiatives, perhaps those of you who are as old as me, in the late 90s, early 2000s, it really didn't work out well because the scale up of the program, you know, really needed to look at it from a holistic approach, and HIV was fueling TB in South Africa. So that is why that they started thinking about integration of the programs. And again, integration of the program for years, many Ministry of Health been struggling. Why? Because the way funding comes, this is outer context, right? Funders give funding to TB or to HIV. They don't want to fund to the health system problem. And that actually influence on the burden of the disease. So vertical implementation in some settings could be quite successful. In other settings, it could be failure, perhaps. So I guess that's what you perhaps were thinking of. And it goes with vector control, you know, in Latin America. I think you have a lot of dengue, a lot of, you know, the leishmaniasis, others. So if you have a more horizontal, not vertical implementation, that probably is more successful. But again, as we all know about different pillar of health system, huge issue with human resource, with funding, with governance, etc., etc. Here we are just talking about implementation research, but we still need to keep into consideration the different contexts. I stop here.
Okay, thank you so much, Manaz. I think we've reached the end of our time. I'd first like to give a round of applause for Dr. Piyusha Majumdar. Thank you so much for getting us started on this weekly IR lecture series. Thank you.
And thank you to Anna. Thank you for Anna to, you know, arranging this. Thank you to all of you for joining this session.
Absolutely. And thank you very much for those who tried our captions. I think those in Colombia, we're having some success with the captions in Spanish as well. So happy to work on these efforts to be more inclusive. Our next session is next Tuesday, May 7th, with Dr. Mritika Barua, and she'll be talking about implementation strategies, identifying them and adapting them now based on all of this information that we have around context that Dr. Piyusha has so successfully set us up for. So thank you all for joining this first session, and we hope to see you next week. Thank you again.
Before leaving, I
you.
request everyone
Thank
to
you.
turn on
Thank you,
the camera
Piyusha.
to
Bye.
take
Thank
a
you, Piyusha.
photo.
Bye.